Our health, our life is in our hands to make it better. Of course, we need to work together. A very pleasant good morning. Welcome to another informative and educative edition of the program Road Way to Health, an hour-long program brought to you by the Ministry of Health. Of course, designed to educate, inform, and empower you about health-related matters. Today is Tuesday, the 24th of March, 2026. And driving you through this edition of the program, my name is Angeline Noah, and I'm here always with
Melvin Stewart.
Together we are here this morning to bring you information very relevant to your health. So however way you are joining us this morning, wherever you are joining us from, we'd like to say welcome. It's always good to be here with you. For those of us joining through the Ministry's official Facebook page, I'd like to encourage you to like and share the live stream, invite a friend to watch along with you. And to our dedicated radio listeners, thanks for always joining this program. Stay tuned as we have a beautiful package for you this morning. Well, this morning we have invited in studio the National Leprosy and Tuberculosis Program of the Ministry of Health, set to bring you more education on tuberculosis, of course TB this morning, as today is marked as World Tuberculosis Day, World TB Day. In other words, for people who are familiar with the word TB, today is World TB Day. So we are here this morning to give you more awareness, as much awareness as possible on tuberculosis, TB, of course, so that you know that this disease still exists in the corners of Liberia and you need not to ignore this condition. So we'll take a very short break, and when we come back, we'll be introducing our guests.
Let's go together. Our health, our life is becoming.
Welcome back, and thanks for rejoining us. This morning we have invited in studio Mr. Benchima Queenie, Case Management Coordinator, National Leprosy and Tuberculosis Control Program at the Ministry of Health, who is also here with Mr. Joe B. Bianga, Case Management Coordinator as well at the National Leprosy and Tuberculosis Control Program. Together, they will be providing awareness this morning on tuberculosis, as today is World TB Day under the theme, Yes, We Can End Tuberculosis, Strengthening Global Action Against Tuberculosis. But before we join our guest this morning, we will of course join Melvin Stewart to bring us some development updates from the Ministry of Health, as we usually do on this program, having our radio listeners informed about what's happening within the health sector. And those of us who have smartphones or access to social media, we always encourage you to follow the Ministry's official Facebook page. So let's join Melvin Stewart to bring us development updates this morning before we join our guests. Good morning, Melvin.
Good morning, Angel, and good morning to our precious listeners across Liberia and those that are following us on the online platforms. It's another good time again to be on the People's Radio and the People's Program, the Ministry of Health.
It's always good to be here with you.
Yeah.
Yeah, so...
Of course, so like you said, we normally do this to highlight some of the activities of the Ministry of Health. On yesterday, March 23, 2026, the Ministry of Health reaffirmed its commitment to advancing gender-responsive healthcare, describing gender equality as a cornerstone in strengthening Liberia's health system. That disclosure was made in Maigidi County. Speaking through her proceed at the celebrations marking International Women's Day in Maigidi County, the Deputy Minister for Administration, Martha C. Morris, emphasized that the observance must extend beyond ceremony to deliver tangible improvements in the lives of women and girls. Delivering a keynote address on behalf of Deputy Minister for Technical, that's Deputy Minister, Technical Assistant Susan T. Clemen, stressed that this year's theme, Give to Gain, delivering gender-responsive healthcare services, now should inspire concrete actions aimed at addressing persistent inequalities in access to healthcare. She described the theme as both a call to action and a message of hope, noting that meaningful progress requires deliberate and sustained interventions. And again, remember the Minister of Health, Dr. Louis Puto, has since taken over this portfolio, has been seriously engaged in training of manpower and building capacities and all of that of all health of many health workers across Liberia. It's not just limited to Central Monroe or just up to Monrovia, but in the other parts of Liberia. The Assistant Minister for Curative Services, Dr. T.I.S. Moore, is currently in Nairobi, Kenya. They've already returned, and they were there along with 17 other nurses that have gone to specialize in different nursing trainings and all of that. So they're back to country to contribute to the adequate delivery system of the healthcare of our country. Then we will go to let me go to India. But India quickly. Let's just get this. The government of Germany, through the World Hunger Life, in collaboration with the Ministry of Health, recently dedicated a more than 60-bed facility named the Domo Nimelin Maternity Hospital in Sasstown, that's in Grand Crew County, to strengthen healthcare delivery in the southeastern part of Liberia by expanding access to quality services and prioritizing maternal and neonatal care for surrounding communities. So these are things taking place under the watch of Minister Louis M. Puto and all of her deputies and all technicians that are working within the Ministry of Health. So I pray that we keep seeing all of the good things coming from the Ministry of Health, because any nation that is supposed to survive must have a very productive health system. Enjoy.
Exactly, Melvin. Thank you very much for bringing us our development update this morning. That's it for development updates portion of this program. To get more information on what's happening within the health sector, you can do yourself a favor by visiting the ministry's official Facebook page to read more development updates. So with that, this morning we will join our guests in studio. We are already seated and set to bring us some awareness this morning on tuberculosis. So we'll join our guests, beginning with Mr. Queenie. Good morning.
Good morning.
How are you doing this morning?
I'm doing great this morning. Nice to be here. I want to say good morning to our precious listener, and then to our studio. We say thank you this morning for inviting us here. I also want to thank the leadership of the Ministry of Health and our bosses from the National Level of TV. We want to say thank you.
Okay. Mr. Bianca, good morning.
Good morning. Thank you very much for also allowing me to be here. Thank you for always broadcasting the information about TB that will be acquainted to know exactly what is TB across Africa. Thank you very much.
Yes, of course, it's important to keep people informed, because informed people make informed health choices, and that is what your work is about. So it's good to have you here this morning also. Today is World TB Day, or day set aside to raise awareness on this condition like other conditions, and we are here this morning to raise more awareness on this condition. To begin with, I want us to firstly tell our listeners what tuberculosis is. I mean TB, because that's the simplest way they can understand it. What TB is, because most of the time it's associated with coughing. So when people see people coughing, they just, kind of think it's just TB. Some people understand it that way. So let's provide that education first to give the difference between, the type of cough to think of as TB.
Okay, so we should give some detail about that. And you are showing signs and symptoms, you are coughing. So that disease, the fact that it's an airborne disease, by coughing, you are releasing thousands of bacteria into the air. Thousands of germs are released in the air when the person is coughing and sneezing. So someone sitting nearby we breathe in and we breathe out, right? So someone sitting nearby, once they breathe in, they have inhaled the bacteria, giving them a TB infection. But there's a different road to it. The fact that that person nearby inhaled the bacteria and has the TB infection, that doesn't mean that automatically they will have to have the TB disease.
Yeah, I know we'll definitely get to
We'll
the
get to that point.
translation or aspect of
Yes,
it.
yeah.
I just want us to focus more
So
on.
when we talk about TB disease, we say it's a infectious disease that can affect the lungs. It can also affect other parts of the body. And TB, when we talk about TB, is a disease that caused by a bacteria called Mycobacterium tuberculosis. So that's the key definition about TB. It's a bacterial infection. It's not like a virus infection. So, and that bacterial infection can be treated. Patient can be treated and they can be cured. That's the good thing about it.
Okay.
Yeah.
So, how can one come in contact with the bacteria we are talking about, the one that's responsible for TB?
Okay.
Yeah, Mr. Bianca.
Okay, so you asked a last question by saying how can someone contract the bacillus. So as my colleague was saying, the first thing before you, and then when you are infected, if care is not being taken, then from there you will enter into a disease stage. Now, and another thing is that, and how does that really happen? If someone is in your house or even to your workplace or places where in which the person is already having the disease and no care has been taken, the person is now on drugs. When the person is coughing, he will cough the TB in the air, and then you that do not have the condition at that time, you come in contact with that infected air, and then after inhaling that another air, from there you yourself you also calm down. So meaning TB is being contracted in the air from an infected
individual.
Yeah, exactly. And yes, the good news is that you can be infected. So the message we came also to Grandpa is that yes, you can get it from the air from one person to another. But if you are also taking your drugs, it will be difficult for you to also pass it to your colleague or to your family. So these are things that this morning we are here to also tell people.
Okay,
So then let's get it very clear. Somebody who has it already, that person is already infested with the disease, right?
Exactly.
Then I'm free from it.
Exactly.
But the person is my spouse.
Yeah.
But I don't know whether this person has
Yeah.
this condition, because the person hasn't been diagnosed.
Mm-hmm.
It's something unknownly, right?
Yeah.
And the person and myself, we are still together. We're eating together, but we're not using the same spoon.
Mm-hmm.
Yeah.
So I think I know what you're driving at. The first thing is that you're saying that the person has been diagnosed. So I think another question is, how should I know that the person has TB? Because if the person has been diagnosed either by a machine to see okay the person has TB, the first thing is that there will be signs and symptoms. There will be signs shown that yes, I think my wife or my husband or my child has TB. How do you know? The first easy way